Hello everyone, myself Dr. Sanjeev Verma and I am Associate Professor in the Department of Ophthalmology at JNU IMSRC in Jaipur, and I am here to discuss about myopia. The term myopia is derived from the Greek word that is the myopia, that means the short-sightedness, a condition in which the near vision is clear and the far vision is blurred. In the year 2050, almost 50% of the world's population are expected to be myopic. By definition, we can say this is a condition in which the parallel rays of light coming from the infinity are focused in front of the retina while accommodation is being at rest. Now, what are the different risk factors? So, first is the excessive near work, then parental myopia, that means the parents are myopic, then there will be more chances of development of myopia in children. Then next is the less outdoor activity. The children prefer to play indoor games, in them you can see more chances of development of myopia. Now about the causes, so I have this model by which we can understand the things easily. So first is the axial myopia, in which the axial length is more than the normal. The second is the curvature myopia, in which the curvature of the cornea, curvature of the lens is more than the normal, and if the refractive index of the lens is more, or the anterior displaced lens. Now about the symptoms, we all know that the distance vision is blurred and the near vision is clear. And half shutting of eye, to see the image clearly, patient will try to squeeze their eye. And in the signs we can see some the prominence of the eyeball, and the retinal changes can also be visible in case of the pathological myopia. Diagnosis is based on the retinoscopy and on the A scan. The treatment is, we can use the concave lenses as spectacles or contact lenses. Surgery like LASIK surgery or implantable polymer lenses can be implanted in suitable patients. If the age is more than 18 years and if the refraction is normal, then we can use surgical methods. And to stop the progression of myopia, we can use low dose atropine drops. Thank you.